Okay. Wow. Thank you guys so much for that great talk. We are on to our last invited speaker of the day, but definitely not least. I'm just pulling up my intro from her. Okay. So I am very thrilled to introduce one that I am personally excited about as I have gotten into my fourth decade or fifth decade, I guess that is, in my 40s. I really have noticed that I am older and I don't like that. So I'm trying to reverse that as much as I can with dietary intake because that's an easy way to target that, and I'm not going to start exercising. So I am thrilled to welcome today Dr. Kelita Waterton. Dr. Waterton is a skin research fellow at the Department of Dermatology here at SUNY Downstate. She got her MD and her MPH from here at SUNY Downstate, so she is homegrown and we are quite proud. She focuses on bridging the gap between clinical medicine, population health, prevention, and epidemiology. And she is completing her research fellowship in dermatology here at Downstate, studying interventions aimed at reducing symptoms of inflammatory skin conditions like hidradenitis suppurativa. Sorry, I thought there was a list. And then her interests include dermatology, patient education, and preventative care. And I think this talk will be really helpful for all of us, but particularly those of us who are old. All right, Dr. Waterton. Let's make sure we're recording. You can use that mic too, sir. And we are.
Use this one?
Yeah.
Okay. Thank you for having me. Um, so yeah, who wants beautiful skin? Raise your hand. Okay, so I think we're all in the right place. As you can see, this is meant to be a less formal presentation. We'll start off talking about some of the nutrients that has the most dense data regarding its impact on skin health, and we'll end with some of the more common inflammatory conditions that we see in dermatology clinic and some of the nutrients that may possibly help with reducing the severity of those conditions. Okay, so why does nutrition matter? I'm sure we've heard you are what you eat, and I'm sure many of you have had patients that may have asked you, what are some things I can do to change my lifestyle? And one of the first things that we think about is our diet and how we can manage or change our diet to help to address whatever symptoms or conditions that we may have. So some certain conditions can help to support the skin, to help to support skin repair as well as a barrier. And you'll hear that term skin barrier a lot during this presentation. It's a very important factor in maintaining skin health. And the way that we get those nutritions are commonly through vitamins, minerals, and healthy fats. Some other common themes are inflammation, oxidative stress, and immune function. And those can all be affected by our diets. So you can think of skin as barrier as well as an immune organ. We know that skin is the largest organ of the body, even though it's not always looked at as that way. It's our first defense for our immune system, as well as what we look at every day. We look at our skin as a factor that we all attribute to our beauty and the way that we present ourselves to the world. So what diet is most associated with healthy skin? To just to break it down on like more simplistic just ways to look at it, just diets that are rich in fruits and vegetables. I think this is just like the common thing we all tell our patients and sometimes tell ourselves. Um, those diets they tend to be nutrition dense. Also, hydration is very key in maintaining plump, healthy skin. Diets that are diets with limited processed sugars, alcohol, and avoidance of tobacco, as well as diets that are low in ultra-processed foods, trans fats, like those fast food restaurants that we try to avoid, but can't help ourselves to every once in a while. So I'll start talking about some of the vitamins that have, again, some of the most data regarding skin. Now, this is not an exclusive list. There are many more vitamins that contribute to the skin. This is just a select few. So I always start off with vitamin D. So about 40 to 50% of the US population is actually vitamin D deficient. when you look at the population that SUNY Downstate and Kings County serves, which is mostly, or a lot of our patients are skin of color, that percentage can sometimes even double, just because we have more melanin in our skin that reduces the amount of vitamin D that can be absorbed from the UV rays into our skin. So vitamin D has been shown to decrease inflammation, improve wound healing, as well as reduce DNA damage, photocarcinogenesis that's caused by UV rays. So it essentially helps to protect our skin from the sun. And the DNA damage and the photocarcinogenesis, those are the things that lead further down the road to skin cancer. Skin cancer is largely due, especially when you think of melanoma, squamous cell carcinoma, are largely due to the damage that we get from the sun over time, over many years. So whatever sun exposure you get as in your teens, 20s, will often show itself in the 60s, 70s, 80s. Not always by skin cancer, but sometimes other sign of skin damage, such as you may see dark spots, increased wrinkles, what we call age spots, things of that nature. So vitamin D has been shown to protect against those changes to our skin. And common sources of vitamin D include fish, milk, yogurt, cheese, mushrooms, fortified orange juice, and fortified almond milk. So the next vitamin is vitamin E. So vitamin E is another one of our fat-soluble vitamins, but it also functions as a powerful antioxidant. So the antioxidants are what helps to protect us from the oxidative damage that we get from the sun over time. It also helps against collagen breakdown. So Dr. Wellick was talking about, getting older and noticing changes to your skin. A lot of that is due to not only the impact from the sun, but also just the reduction in collagen that we have in our skin over time. So the collagen is essentially, if you think about the skin cells as the bricks that makes the house, the collagen is essentially the scaffolding that helps to keep it together. So as we lose collagen over time, that's where people start to lose some of the plumpness that they see in their skin or develop wrinkles over time. So vitamin E has been shown to help to reduce that damage and as well as skin inflammation. So common sources of that will be sunflower seeds and oil, nuts, spinach, broccoli, kiwi, and mangoes. The next vitamin is vitamin C. So vitamin C is very popular in the dermatology community, not necessarily as something that we take orally, but it's something that we apply to our skin as serum. I'm sure many of you have heard of vitamin C serum that helps to protect against discoloration of the skin. It also stimulates collagen and elastin synthesis, which again helps to maintain the structure of our skin. And it acts as a defense against UV-induced photo damage and accelerates wound healing as well as improve hydration. So the more oxidative stress that you have over time, the more they start to form wrinkles and hyperpigmentation. And those hyperpigmentation can happen just by age, but also as a post-inflammatory effect. So sometimes we have acne or some sort of rash on our skin. A lot of times, especially if you have darker skin tones, it can heal with what we call post-inflammatory hyperpigmentation. So sometimes patients will use a topical vitamin C serum to help to reduce that, but we see that actually oral vitamin C can help with that as well. So foods that are rich in that, of course, are citrus fruits, are oranges, but also red and green peppers, kiwi, broccoli, strawberries, Brussels sprouts. So some other nutrients that are, I guess, not technically considered vitamins, but are also very important. Omega-3s, I know we typically associate omega-3s with heart, with having a healthy heart, but also can help with our skin as well, as demonstrated to also be anti-inflammatory. It relieves symptoms of dryness and irritation that are commonly the complaints that patients have when they have inflammatory conditions such as eczema, for example. It also helps to improve the skin barrier as well. And this can be found most commonly in fish that it has high levels of omega-3, especially the fatty fish like salmon, mackerel, and sardines. And some of the plant-based sources for those who don't eat fish can also be flaxseed, chia seeds, walnuts, and some foods are fortified with omega-3, such as certain dairy products, juices, eggs, etc. A few other nutrients, one is zinc. So Zinc is a mineral is actually found in every cell. I actually just learned myself it's found in every cell of the body, but is highly concentrated in the outer layer of the skin, the epidermis. So this plays also an important role in maintaining skin integrity and also promoting wound healing as well. And collagen comes up again as something that's very like an integral to maintaining our skin health. And also protects against inflammation and infection. So infection is actually pretty important when we talk about conditions such as atopic dermatitis. Those conditions, it disrupts the integrity of the skin. And when you have that disruption, you have increased risk of later developing skin infections. And that can sometimes happen with kids who have eczema and then they eventually have impetigo and other infectious skin conditions such as that. So foods that are heavy in zinc include oysters, red meat, poultry, legumes, nuts, seeds, as well as dairy products. So collagen is not only something that we have in our skin, but also something that we can also get from outside sources as well. So it's found in typically only in animal connective tissues. So that has been shown to actually increase the skin hydration, elasticity, as well as decreasing wrinkles. So most of the sources that we get this from would be from chicken, fish, pork, beef, and also gelatin as well. Bone broth has become more popular these days. People are integrating bone broth into their foods, their soups, etc. So that can also be a great source of collagen. Um, but polyphenol is actually something that I just learned about when I was doing this presentation. It came up a lot in my research as something that can help with the skin. So this also helps against photo aging as well as reducing hyperpigmentation as well as supporting collagen production. And that can be found in a lot of fruits that we typically eat every day, such as berries, apples, cherries, grapes, pomegranate, spinach, broccoli, some teas, and even olive oil and chocolate. So you are allowed to have some chocolate here. And lastly, probiotics. I know we have some GI people in the room, so I'm sure uh, some of you have had discussion about probiotics with your patients and whether or not it's recommended for them to take them. So the gut-skin axis just refers to the bidirectional relationship between skin and the gut. So the gut microbiome, or I should say imbalances in the gut microbiome can have implications to the skin as well. So, and probiotics actually has something called ceramides, and ceramide is something that a lot of people who have atopic dermatitis lack, and that causes their skin to be extremely dry and itchy. So, probiotics actually provides ceramides. So that helps improve hydration and skin barrier support and reduce systemic inflammation. So yogurt is probably one of the more common sources of probiotics that people tend to gravitate towards. Kefir, if I'm pronouncing that correctly, I think that's also becoming more popular these days as well. Since sauerkraut, kimchi, and miso can also be um, sources of probiotics. So now I'll talk about a few skin conditions that there seems to be more research on in terms of how certain nutrients impact the severity. So eczema, that's probably, especially in pediatric dermatology clinic, the most common condition that parents bring their children in for. So that's a chronic recurrence. The recurrent is an important term that we have to tell patients all the time. Is recurrent is not is very hard to cure. There is at least not a recognized cure for eczema. So it's something that patients constantly come in for and parents constantly worry about. So vitamin D has shown mixed results. And honestly, with a lot of these conditions and a lot of the research, which I think our first presenter touched on, there's not enough research that's being done, and a lot of research that does exist conflict with each other. Where one will show maybe a modest improvement, and some will show no statistical significance at all. So there's a lot of mixed results and not a lot of randomized controlled trials that would, of course, be our go-to in terms of evidence-based medicine. So that being said, vitamin D and vitamin E have shown modest results. There was a study where they actually looked at vitamin D with the vitamin E placebo, vitamin E with a vitamin D placebo, and then they looked at patients that they gave both vitamin E and vitamin D. So vitamin D and vitamin E individually, they had like about like a 34 to 35 improvement in the SCORAD, which is just a scoring system that we use particularly for atopic dermatitis. However, when they used vitamin E and vitamin D together, there was about a 64% improvement. So they have an additive effect or the evidence in that particular study showed that there's an additive effect when you use them together. And in this condition, probiotics has also been shown to reduce severity, but particularly in the pediatric population. We also talked about food allergies in a prior presentation as well. So a lot of parents come in and they wonder if the eczema is due to an allergy, and they go to allergists and they try to see if something that they're giving their child has caused them to have eczema. And you tell them that there's very little evidence to support that eczema is caused by food allergies or even worsened significantly by food allergies. Actually, on the contrary, patients who have eczema, as we talked about in a prior presentation, are more likely to develop allergies because their skin becomes sensitized to certain components of what they're eating that later on may become an allergen. So it's the opposite effect than what parents tend to think. So acne is also very common in adolescent population, but even in the adult population as well. So vitamin D and omega-3 have been shown to reduce inflammatory lesions compared to placebo. But when it comes to probiotic, it's been shown to decrease inflammatory lesions and non-inflammatory lesions in patients with acne compared to placebo. And then multiple studies have shown that diets that have high glycemic index, as well as diets high in dairy intake, are associated with increased and acne severity. So they may not cause acne to begin with, but they may increase the severity of the acne. And then diets are rich in vegetables, oily fish, nuts, legumes, essentially in a Mediterranean diet, are associated with better outcomes in patients who have acne. And then the last condition is psoriasis. This is another inflammatory condition. It's a chronic and immune-mediated skin condition. And as we talked about earlier, our immune system is tied in with our skin health as well. So omega-3s have been shown to have mild improvement in redness and scaling when used in combination with conventional therapy. So not necessarily used to replace treatment, but to be used in combination with the standardized treatment. So vitamin D supplementation, that's also something that has like mixed results. The results that are more promising are patients who have been identified as being vitamin D deficient, but the results are a little more muddy with patients who actually have sufficient vitamin D. And we would think that we would have better results, being that we do use topical vitamin D analogs as a way to treat psoriasis, but the data is just lacking in oral vitamin D supplementation. But foods that have more evidence to help patients with psoriasis are Mediterranean diets that includes fish, vegetables, fruits, etc. So some take-home points is that essentially like plant-based and Mediterranean diet, like holistically, they tend to include these vitamins and nutrients without you having, I mean, I'm sure they can squeeze almost any nutrient into a tablet and sell it. But if you incorporate this type of diet into your own personal life or your patients, is likely to include a lot of these nutrients naturally. They tend to be high in antioxidants, polyphenols, vitamins, and healthy fats. Also, higher intake of vitamin C, polyphenol-rich foods, as well as adequate hydration are associated with less skin dryness, fewer wrinkles, and better overall skin appearance. And then lastly, lower intake of dairy, processed food, and high glycemic index foods reduce risk of inflammatory skin conditions, especially conditions such as acne. And then this is just some like meal ideas that incorporates what we talked about. So like one of it is just like it's like a yogurt bowl. Yogurt would provide the probiotics. The berries would provide the antioxidants, etc. And salmon is one of the most common components of a Mediterranean diet as well. So that's just a second option. And then these are my references. Thank you.
Okay, that was fantastic. And I don't think I've ever taken as many pictures as slides, which I am then going to reference later and then go through my kitchen. So thank you so much for that. Did anybody have any immediate questions? If not, I have one. Okay. So I'm always curious. There's a lot of literature on these, but a lot of these studies are smaller or maybe not as clear. And one of the things that always throws me about collagen, I've seen it replicated a bunch, but collagen is a protein.
Right.
And proteins don't tend to survive entirely intact when you eat them. So is it just the three predominant amino acids in collagen that are really beneficial, or is there something about the actual, because it is a repeating structure, is there something about like a smaller version of the peptide that is actually beneficial, they think?
Are you referring to like collagen in general or taking it as a supplement?
Taking collagen as a supplement. What always confuses me, right, about some of these things is, for the vitamins and minerals, that's easy. That's getting into the body. But collagen is just a protein, and it will be changed by the part of eating it. So I'm like, how do you get the collagen?
Right.
When you talk to people in the wellness industry or whatever, they say, oh, it's collagen, you eat it and it absorbs into your body, but that doesn't make sense entirely.
Right. I agree that there's like some like mixed data in terms of like whether or not we can actually fully absorb collagen, especially in the way that it's processed. And
Yeah,
like a lot of these supplements aren't really like FDA approved, and people just like put things out there.
definitely.
I think the better way to approach it would just be like some of the vitamins that we talked about that can help to reduce the degradation of the collagen rather than trying to replace it by taking it in.
I guess one question I have, and this might just be a wish for future research from somebody who's maybe a research fellow, is I'm curious if it's the collagen or the nutritional value. If it's like an amino acid supplement that replicated collagen would be just as effective. And I think you could answer the question with that. So I'm just sort of fascinated because I just think it's really cool. Anyway, thank you so much.
All right. Thank you.
So much. Oh, great. Okay. Let's give everybody a couple seconds to use the restroom, get some water if they need it, re-up on coffee, or eat one last snack, and then come back here, please, in 5 minutes, and we will start hearing from all of you. One announcement that I wanted to make is that the faculty will vote on who gave the best presentation, and you will get a Golden Beat Award, which our third-year fellow, Bryce, who had a conflict, is currently 3D printing for us. And we will put your name on it, and I will find a way to get it to you somewhere in New York, wherever you are, once it is done. So we will give out 2 of those, one for communication, one for presentation. And it's not going to be based on scientific content because we know that's variable and depends on resources you came from. It's based on you. So have fun.